Right. Thank you very much. Hello, everyone, and welcome to the Armenian American Mental Health Association's conference 2025. This year, our theme was Healing Across Generations, Breaking the Silence on Mental Health in Armenian Families. And currently, we are going to have our fifth and final panel for our two-day conference, which has been so incredible, and so much wisdom and so much knowledge and research has been shared in these last 2 days. Today's final panel is on the topic of mental health and the older Armenian adult population. We will have two presenters, or the first one will be a group, will be by Maral Armenian and Lily Kamalian. They are both psychologists and researchers, and their topic will be called Culturally Responsive Approaches to Promoting Mental and Brain Health for Armenian Older Adults with Dementia. And then we will hear from Dr. Jane Mahakian, the journalist and founder of Alzheimer's Care Armenia, and our topic will be called Artsakh Elders Support Cafe. And so each presenter will have about 25 or so minutes. That way we can also accommodate for any questions amongst panelists, but also we are live on Facebook, so we might get some questions there as well. So without further ado, Maral and Lily, would you like to begin?
Yeah,
Thank you.
thank you so much. I think one has to let me screen share.
Mhm. Oh, okay. I think there we go.
All
Does that
right.
work?
Yep, I think so.
Excellent. All
Okay.
right, there we go.
Does that look good?
Yes, perfect.
Wonderful. Okay. All right. Well, thank you all for having us at this conference. It's really wonderful to connect with other Armenian professionals interested in using our knowledge and training to help our community. My name is Maral. I am a neuropsychology postdoctoral fellow at the San Francisco VA, and I'm here with my friend and colleague Lily, who is also a postdoctoral fellow at Columbia in New York City. So for our presentation today, we have the following objectives. First, to understand the impact of culture and stigma on dementia care among Armenians. The second, to explore clinical and community strategies for culturally responsive care. And the third, learning how to leverage family dynamics to improve patient and caregiver outcomes. So dementia is a growing global concern. Every year, there are about 10 million new cases. In 2021, about 57 million people worldwide have been identified as having dementia, over 60% of these individuals living in low and middle income countries. Ethnic minorities, including Armenians, face higher rates of underdiagnosis, limited access to culturally competent care, and unique stigma-related challenges. Dementia results from a variety of diseases and injuries that affect the brain. Alzheimer's disease is the most common cause of dementia and contributes to about 60 to 70% of cases. Signs and symptoms that are a big change are not inevitable, and understanding their cause and how to best maintain quality of life for all involved is the goal. So traditional views on aging vary across cultures and can shape societal attitudes towards dementia. In some cultures, aging is revered and respected, while in others, it can be associated with more negative connotations or stigma. For example, cultures that prioritize intergenerational support may perceive dementia as a personal or familial failure, leading to increased stigma and shame. In collectivistic cultures where family and community are highly valued, individuals with dementia are often cared for by the family members within the home rather than in institutional settings. So various medical conditions, some of which we've listed here, have historically been stigmatized around the world. In addition to the emotional burden of experiencing stigma, it can also serve as a significant barrier to healthcare. resulting in delays in diagnosis, a lack of disclosure of one's health status, and even impacting treatment or medication adherence. So these negative consequences can have downstream effects on physical and mental health, not only for the patient, but also for their loved ones, their family, the caregivers, and so on. And this can contribute to delays in healthcare, feelings of social exclusion or isolation, and ultimately negative effects on mental health and emotional well-being. So this leads us to the role of stigma among Middle Eastern communities, where these beliefs may be deeply rooted in cultural upbringing, religion, and family customs. So there may be a greater emphasis on spiritual or deterministic views of illness, which essentially means there's a belief that illness is predetermined and inevitable. There's nothing we can do to prevent it. Finally, there is this notion that mental illness, which may include dementia, is associated with some kind of shame or religious punishment. And given this, the idea of paying someone for help or even advice may run counter to centuries of self-reliance and may even be considered shameful or dishonorable. So let's stop for a moment to consider how the language we use can contribute to stigma. A recent paper by Siete et al. From 2023 highlights the negative connotations associated with the term dementia in a number of different languages, including Chinese, Arabic, Vietnamese, and the Punjabi language. So if you look at the screen, you see a number of negative connotations here related to things like lunacy, idiocy, quote, mental deterioration, things like that. So keeping that in mind, let's move on to Armenian. There are a number of terms that have been used. While the word dementia has been used, other terms include tulamadutun and xelakarutun. More colloquially, other terms might include telkederechi or tsantadza. So understandably, not the most positive connotations to these terms. So among Armenian populations, both in Armenia and diasporic communities in the US, we see similarities with broader Middle Eastern trends, as well as unique cultural features. So this includes limited knowledge and exposure to dementia care services. Family needs tend to take precedence over individual needs, and the importance of maintaining a strong sense of family honor is often continually reinforced. Armenian children may be taught not to bring shame or amot upon the family name. In some situations, traditional beliefs may persist, even when one has exposure and access to dementia care services, such as here in the US. And finally, caregivers carry a large load. And for younger caregivers, navigating the line between the US medical norms and the traditional cultural expectations can pose all kinds of unique challenges. So let's pause here for just a brief case example of someone Lily worked with. We're calling him Gato for our example. So Gato was seen for a neuropsychological evaluation due to concerns about forgetfulness over the last 2 years. He lives alone. He gets help from one close family member who tags along for appointments, cooks for him, and fills in gaps in his memory. He stated that he has a big extended family, but that they don't get together that much and that he's lost touch with a lot of his friends. Stress makes his symptoms worse. He reported that a lack of social support, frustration, or tension with other family members who don't understand his mood and cognitive symptoms are difficult for Gato to manage. His family members stated, "It's no big deal. He's just lost his confidence." She and the family hope that he'll eventually regain it, believing that that would help his memory. Gato voiced dealing with stigma surrounding discussing mental health difficulties in this culture. However, he was open to discussing his mood and distress during the session. So let's pause and take a look at some of the themes that arise in this kind of brief example that are very common. Isolation, so not seeing family and friends as much while this used to be a big part of his life. Wanting to be understood and seen, so wanting clinicians to understand his suffering and wanting family to understand his symptoms while managing the difficulty of communicating this. The family thinking this is just a confidence issue rather than an organic or medical issue, so sort of minimizing. Stress is an added cognitive burden and can exacerbate memory difficulties. So, having to explain that it's not one or the other, but rather both at the same time. And finally, not feeling free to discuss his cognitive and emotional symptoms with support systems. So, that internalized stigma that he holds.
So, how do we navigate cases like this? What are some ways that we can use our cultural practices to our advantage? So this next half of our presentation, we want to explore several recommendations we have for culturally responsive approaches to brain health promotion, as well as the management of dementia once it is diagnosed. Next slide, Mono. Thanks. So we want to promote cognitive and brain health across the lifespan. And we can do this by enriching physical activity with group, social, and cultural practices. Physical activity is key. It comes up as very important across all of our research. And incorporating these cultural aspects makes it more sustainable for the individual, helps with accountability, and it strengthens our relationships. So things like community dance and music, all of this reinforces the brain's resilience to illness. It's also possible to incorporate aspects of the Mediterranean diet in family meals, a small change into a cultural tradition. The Mediterranean diet has been shown to improve cardiovascular disease and lower the risk of Alzheimer's dementia in older adults. So a recommendation would be to use olive oil more often than butter, or replace some red meat with fish or legumes throughout the week. Lastly, we as clinicians can also promote talking about dementia with trusted individuals. Improved diagnosis and education about dementia is an intervention itself. So if your clinic serves Armenians, make sure that there are educational materials that are available in Armenian or whatever language that population speaks best. Recruit and train bilingual, bicultural, multicultural clinicians who can serve this community and break this barrier that we have of, quote, we don't speak about such things in our community. When thinking about diagnostic conversations, include family across generations. So spouses, children, grandchildren who are also impacted by this illness. And as for ourselves as clinicians, it's important to stay informed about new research and what is available in the community to help families plan for the future. As therapists, it's important to inquire in a curious way about areas of tension. So modeling that curiosity using some motivational interviewing conversational structures to allow families to reflect and express shifting and dynamic perspectives on caregiving. It's not a one-time conversation. In our clinic, we can provide resources for those who are caregiving. So we can run support groups or different activities and again, have them be available in English and Armenian. And we can help our clients that we are seeing who are caregivers with some practical brainstorming. So how do you set up the pill box? How do you schedule supervision time? What are your babysitting options, respite care, things like this. So caregivers are often isolated and overwhelmed, largely because many are part of this sandwich generation. So these are often adults who are simultaneously caring for aging parents and their own children. And so we recommend, if you're working with clients who are in this caregiving role, to leverage the sense of pride that we have in helping our family with this need to take care of yourself in order to care well for others. So you can say something like, I imagine it fills you with purpose to be able to care for mom. And we want to make sure that you're able to do that for as long as possible. So what is one change in your schedule this week that would give you a break? Having conversations like this can be really helpful. And we need safe spaces to do this, right? So safe spaces for dialogue across generations can strengthen families and reduce burnout. As a community, we can do a better job of having open discussions about difficult topics. And as professionals for advocating for brain and mental health, we can do so much more beyond diagnosis and treating psychopathology. We can teach and improve skills in emotional labeling, expression, distress tolerance, coping, assertive communication, and listening to understand one another rather than to fix or to criticize. Community partnerships are also a valuable point of intervention and education for our community. So partnering with trusted figures like clergy or cultural organizations, this helps build credibility. And messages about brain health, they land better when they're rooted in our identity and our traditions. Media outreach can help normalize the difficulties that people hide in their home when we learn and heal by talking about these shared experiences together. So one takeaway from this talk that we would like to share is how to use these strengths to navigate difficult conversations. These strengths, be they individual or community-based. So let's say in one scenario, there is a caregiver who you are seeing that is concerned about a family member's potential symptoms of dementia, and they are met with resistance when they bring this up to their loved one who they are noticing these symptoms in. And so if they're in your clinic, there are multiple ways that we can use their strengths. This includes validating those person's observations. You know, they're coming from a place of love and care for your family member. Normalizing having these kinds of conversations with anyone, be that in therapy or amongst other people, other trusted people. And helping, you know, your client think about the short and long-term planning. What is necessary right now in a week to a month and beyond to help care for your loved one, and empower the patient to start thinking about the care team. So it's not just going to be them as the caregiver, who is going to be around to advise and support. And in another potential scenario, let's say there are two caregivers in the family that disagree about the care plan. Let's say one caregiver wants to start looking for potential nursing facilities, and the other one wants to care for the patient at home. What we can do is identify and name this conflict, right? It's very common, this traditional collectivist kind of approach versus a more modern individualistic one. And it's absolutely normal and common to have these kinds of differences in perspective among our community. And reminding them, you know, we're all on the same team. Just because we have two different perspectives here, we all want what's best for your loved one, for the person living with dementia. And if there are disagreements, we can kind of tune into what did the patient express along the disease course? Had they always wanted to be cared for in the home? If that's so, how can we make that happen? And so we have a few slides here on recommendations and their cultural considerations. So this slide here is a few for empowerment and support for caregivers, including a lot of the things that we've already mentioned, as well as finding legal and practical support, as well as religious and spiritual. And then this slide these are some more specific recommendations about seeking respite care and asking for help, which we know can be very difficult and feel very shameful when doing so. Hoping these cultural considerations break that. We also wanted to spotlight a few initiatives within our community that are currently doing a really great job in addressing various aspects of community outreach and organization and education. The first is Alzheimer's Care Armenia, an organization led by Dr. Jane Mahakian, who's on this panel, and we're really excited to hear from today. And this group is working really hard to increase the access and improve Alzheimer's dementia-related care in Armenia through various creative initiatives. Another organization is focused on improving occupational, physical, and speech therapy, as well as disability care in Armenia, and providing educational tools and collaborations with organizations in Armenia. They have webinars and resources for dementia care, as well as other aspects of clinical care across the lifespan. So TBI, autism, spinal cord injury, things like this. And finally, Maral and I founded an initiative called MITK, which focuses on increasing education and knowledge related to brain health for Armenians around the world. We currently provide English and Armenian translations for educational resources related to brain health, including things like neuroanatomy and diagnosis, as well as educational webinars and case consultation. We hope to eventually expand our services to provide networking and mentorship opportunities for Armenian early career trainees in brain health fields. We also think it's very important to highlight the multidisciplinary care being offered to Armenian older adults at various skilled nursing facilities and retirement communities here in the US, We've listed a few here that we know about, and we would love to know if the audience or our panelists have additional centers that they know about, so we can highlight them as well. And so in summary, our talk went through a lot of different topics. We hope that we came across the importance of understanding cultural stigma that surrounds cognitive decline and mental illness, which can hinder diagnosis, access to care, and support. We covered how the language that we use to talk about dementia matters, and that dispelling harmful beliefs is vital to promote accurate understanding of brain health. And there are various ways that we can build rapport and trust to deliver culturally responsive care. And a major way of doing so is incorporating the role of family and extended social networks to provide planning and emotional support, and doing so through the use of our community qualities. And with that, we'll like to say thank you. And yeah, thank you for having us, and looking forward to Dr. Mahakian's talk.
Thank you very much. That was very, very intriguing, and I think an important presentation to have. And I really love the illustrations as well. Are they like original? Yes, I figured. So we'll see if there are any questions at this time. Don't have any questions on Facebook, but I'm open to seeing if uh, Dr. Karibian or Mahakian would have any questions at this time.
I have to just comment to both Doctors Lily and Marl. That was really outstanding.
Thank you.
Outstanding presentation. And we look forward to collaborating with your new organization. The cognitive and brain health promotion is so important, not only in our country, of course, I mean, worldwide, but, of course, in Armenia. And, you hit the nail on the head with the group activities and, that need for social engagement. As neuropsychologists, it goes hand in hand with, the progression of the disease, right? If you're not socially engaged.
Yep.
But it was very, I think, very informative. And I think it's fantastic what you're doing. It's really great. The next time I'm up in you're in.
Yeah, we're split up.
In
California,
right? Yeah. At my old stomping ground. You're at SFVA, right? Yeah. So, in any case, we look forward to collaborating with you, with both of you. Yeah.
Thank you.
And helping we can help
Thanks.
Absolutely.
Thank you.
Great presentation. Thank you. And I was wondering, as we know, there is a lot of stigma around mental health, as you mentioned, and probably that's even more for older adults. So what are some of the perhaps approaches or ideas that you have or seen, like, to help the clients to be open about their challenges, their issues, and to also maybe approaches to help them to know about therapy and be open to talk about their challenges without shame, or reducing the shame as much as possible?
Mhm.
Yeah, such a good question. I can start. I think that the creative solutions are necessary here. So I think that the sort of letting an older adult know that therapists exist is probably not appropriate or going to cut it here. I think that we have the benefit, like Lily mentioned in our slides, of having the strength of our family dynamics as one of the big strengths in our culture more broadly. And just like we talked about leveraging that in the slides, I think this is another place to really see, is there a place to approach this from more of a collectivistic and family perspective? So there are lots of fantastic family therapists out there. There are lots of mental health professionals who sometimes come to adult daycare centers and so on, and sort of just share that, we're here and available if you'd like to chat, to sort of break the formality sometimes that comes with psychotherapy. And it feels like this big scary thing, particularly for folks who maybe generationally are very unfamiliar with that. I think that taking a little bit more of this collectivistic approach here is probably what I would recommend, rather than just saying, you know, therapists exist and we can take you to one. I don't think that's kind of sufficient, particularly for folks who are part of these older generations where this was just not, it's not something that was available to them for many, many years.
Yeah, I would add the more that we are visible in our communities in a way that it's not, you know, we're not from an outsider's perspective, but embedded within the communities, the easier it is to establish kind of like a genuine trust with anybody, be they living with dementia or their caregivers. And so if you approach it from, I just want to get to know you and your experiences and how you're doing, and not focus on their symptoms in your first conversation or anything like that, to just really let them tell you their life story if you have the time, and slowly kind of get to know them and spend time doing that, that will kind of open up many doors for them to start telling you about deeper issues and more of the concerning things that might be going on.
Yeah. Most of us here in the Western world are really accustomed to the structure. We know kind of what to do when we walk into a therapist's office, even if you've never been to one. I think that is not very much the case here. Setting that stage and prioritizing the trust and rapport building, I think, takes precedence here. Before, like Lily said, before we jump into symptoms and manifestations and whatnot, getting to know what's your life story. What brought you here? Who are your kids? Who are your grandchildren? What matters to you? Things like that. I think set the stage of, this is someone who both shares my cultural background and deeply cares about me and my values and my well-being. All of that goes above and beyond, you know, dementia, cognitive impairment, anything like that.
And then you as a clinician know so much more about this individual's life. So when you start recommending interventions, you can pinpoint exactly who can help and what is going to work, you know, maybe more sustainably than something else when you get to know that person.
Great, thank you.
Yeah. Really good points.
Thank you
Absolutely.
very much. It's all a very different approach of clinicians going to the centers and going to meet the people rather than waiting for the people to come find them.
Right.
All right. So perhaps we can then transition to hearing more about Dr. Jane Mahakian's presentation about some of the work she's been doing. And I'm sure there will be some more discussion afterwards as well. So if you are ready.
I am ready. Shall I share? There we go. And we certainly have a lot of stigma going on in Armenia. Hello, everybody. It's a pleasure to be here this mid-morning, almost afternoon on the West Coast. And I am Dr. Jane, and I'm going to talk a little bit about Alzheimer's Care Armenia. It was founded in 2017 after I did quite extensive research and you know, a lot of consulting about where are all of the older adults in Armenia and what type of services and programs do they have for people with cognitive impairments. Well, there really wasn't any, really, quite frankly. So I started the Alzheimer's Care Armenia in 2017 to initially develop sustainable programs and services for the person that has a cognitive impairment as well as their family. And then we began to really get involved in policy formation as well as involvement in realizing that as a member of the Alzheimer's Disease International, as well as Alzheimer's Europe, Armenia did not have a dementia plan. They had no national dementia plan. So if you take a look at the United States and many, many other countries, they have national dementia plans. Well, we decided, our team decided to spearhead this development of a plan for the country in cooperation with the with the government, the Ministry of Health in Armenia. And within about 18 months, we had a solid plan, which was formalized by the Prime Minister in 2023. So that's exciting. It really is helping us shape clinical guidelines, not only for primary care physicians on early detection memory screening, but also in the care of that older person who has a dementia, and of course the family. And where do the families go for support? So our key initiatives over these last, almost 7-8 years now, have been the Brain Health Armenia Project, which was funded by Davos Alzheimer's Collaborative, 2022-2023, where we developed a mobile early detection memory screening project. And in cooperation, we collaborated with the Armenian Eye Care Project, and we followed their mobile clinic, their eye clinic around the country, screening their patients for early detection memory screening using the Montreal Cognitive Assessment Test, which is validated and, has validation and is reliable in the country of Armenia. And we also screen patients in clinics and hospitals throughout the country. We also trained around 645 primary care physicians on the use of the MOCA test. And they also trained some of their colleagues. So we had a kind of a train the trainer program that came out of that. We screened about 4,400 people countrywide. And this is the first look really at Armenia and what we're looking at in terms of demographics and prevalence, really prevalence of the problem in the country. We have memory cafes bursting with joy in Armenia. We have 3 of them now in Yerevan, and we have 1 in Gyumri. And they have just been absolutely amazing support for the person that has a cognitive impairment, as well as their families. And then recently, which I'm going to talk about today, the Support Cafe for Artsakh Elders started this past February, and it was supported by the Armenian General Benevolent Union. That was a 12-week pilot project, which I'm going to talk about. And now we are expanding that project. And last, well, not really last, but I don't want to highlight everything within the time frame I have today, but we have now spearheaded this past April the National Dementia Registry in Armenia. And this is a collaboration with YSMU, the National Institute of Health, and Erebuni Hospital. So I guess I'm in charge, George, of my PowerPoint this morning. I will click on the next slide. Of course, nobody, you can't do this kind of high level work by yourself. It's absolutely impossible. Although I did start off all by myself, and then the team started growing. And one of the things that we have developed is what we call a research and development team. And this is just some of our members. We actually have 3 additional members who recently joined us, and they are truly amazing young people, professionals who are spearheading these various projects, and it's just exploding. So I welcome, for those of you who are interested in learning about Alzheimer's, joining our team, whether you have research background or have proposal writing skills. If you have an interest in love of elders, we welcome you to send your resume to me. This is just an amazing group of people who are very committed, professionals, healthcare professionals who are committed and taking ACA to the next level. So what is this Support Cafe all about, right? So I'll tell you, and all you know too. worldwide that the forced displacement, right, of approximately 30,000 elders from Artsakh left a profound impact on their mental and physical well-being. And this impact goes beyond, it's still continuing. These experiences that they endured give rise and have increased their mental health struggles, cognitive decline, and a pervasive sense of helplessness among these displaced elders. Really, they're feeling isolated. They're displaced. Many of them, most of them, are living with family already in Yerevan or in other areas of the country. You know, there's a lot of uncertainty. There's temporary housing and a profound loss for each of them on their historical roots and family separation. So some families are not living together. All of these stressors are compounded for these people, these elders, and they're now having depression, low mental and emotional energy, lower life satisfaction, unhappiness, poor interpersonal relationships, and worsening of their pre-existing health conditions. So we decided to develop a project. And the idea of the project, the objective of the project was to initiate the Support Cafe, which is an intervention to provide purposeful, art-based and memory enhancement activities, music, and socialization in a real nurturing group environment. So we launched this project in early this year, in February of this year, for 12 weeks. We wanted to assess the Support Cafe's interventions that were developed by a trauma specialist in Armenia, as well as we wanted to see what the effect they would have on their mental health of these forcibly, displaced older people. We developed a specialized curriculum and that integrated the therapy. These support cafes were facilitated by trained psychologists and social workers and provided education, social engagement for approximately 50 elders from Artsakh. We had one group in Gyumri and another, of course, in Yerevan. So these 50 adults would get together, 25, of course, in each group, once a week for around 2.5 to 3 hours. And this was a prospective cohort study, which measured their mental health of this population. They were given a series of pencil and paper tests, as well as the data collected from that looked at, of course, depression, anxiety, grief, cognitive impairment, as well as coping skills. So what we are working on right now, before I go into our expansion, is that the data is currently being analyzed, and very soon we will have a manuscript developed and a report that we'll be able to publish, of course. But we will be sharing the outcome of this pilot project very soon. We're just firming things up. The amazing news is we are now expanding our support cafes. With the support and the generosity of the Armenian Women's Welfare Association, we will expand these support cafes to the AAMHA region, to Lori, Kotak, and Arat. And we're launching actually next week. Next week, we are launching on Tuesday. And again, this model that we developed and was so successful during the 12 weeks will be used, as well as we are including some exercise. So we have some cognitive as well as movement therapy type exercises that will be included in this support cafe. I thought it would be wonderful to show you some photos. This is some of our team members who are involved in the support cafe. The support cafe in Yerevan right now is held and sponsored by the AGBU in Yerevan. So we are using their space every week, and it's just hugely successful, as I said. And this is as I said, some of our team members. And this is kind of a fun, you can get a real sense of their energy. This is in Gyumri. This was last week. Some of the participants, there's a total of 20 in that group, are here, and they were doing exercise, and we have 2 psychologists leading this amazing group. The support cafe, this is a flyer that we have distributed. We are developing right now for our expansion 4 different flyers and announcements so that we can help get the word out countrywide, really, because these 4 regions, we have also people coming in and driving in from different regions just to attend, like the Gyumri support cafe. So we are really we're really trying to get the word out about it. And we also have a national radio show that we developed 2 years ago in Armenia. It's a healthy aging show, brain health show, and we are going to be interviewing 2 of our psychologists very soon on this national radio show to help to continue to help get the word out. This photo was taken at the AGBU office recently, again, I believe 2 weeks ago. And these are some of our members. We have 2 of our staff as well as some of our members of the support cafe. And last is, we do various different exercises as well as different types of therapies, reflections, storytelling, a lot of processing work. This is a place where people feel safe. There are men in attendance, which is really, really great. And this is one of our psychologists, Laura, was initiating an exercise with elders that really is more of reflection and helping them really focus on what they're grateful for, which is very, very important. So I am excited about the expansion. My team in Armenia is really excited. We're also really excited to say that, with all of these higher level type programs and services and initiatives, we realize that this is not just having people support us from the United States. This is global. So I've been approached by one of our donors in France to inquire about developing chapters. So ACA, we're now looking to develop chapters of ACA throughout the world. And this will, because dementia is it's an epidemic, and it's in Armenia. We know it is, and unfortunately it is on the increase. I agree and completely, for Lily and Marl, your presentation about underdiagnosis is absolutely correct in Armenia. Even in our country, it's underdiagnosed. What's happening in Armenia is not only underdiagnosed, but misdiagnosed. And that's a huge concern. So there's a lot of more work to be done. This is, the last 7 years has really put dementia on the map in Armenia, and it's opened up more opportunities for other NGOs to begin, which they are, and they are establishing themselves, to daycare programs, to, expanding some of the models that we've developed with the healthy aging clubs, memory clubs, and support cafes, that they're taking those things, and which is great. It's, so the more the merrier, right? We're here to help, and and we're also very big, as I had described last night on the presentation, that we're very much wanting to collaborate, and we believe there's power and in collaboration, and here to help each other. So I want to thank you very much for this opportunity on this Saturday now afternoon to present, and I welcome questions. Thank you.
Thank you very much for sharing the information and about all the amazing work you have been doing for the last several years. I'm just amazed by when you shared, starting off with joining the mobile eye clinic and doing screeners. I think that's really the creative solution MRL spoke about. Like, we have to think outside the box and approach this in really nuanced and, like, interesting ways that will be so much more effective. And I'm curious if the misdiagnosis, is it due to lack of training, education from clinicians? Is it the manuals they're using? Is it the stigma? So they rather have, let's say, depression than dementia. I don't know. Like, I wonder what you found is causing
Dr. Misap, you were involved in that first one of our very first projects of developing that Alzheimer's disease caregiver handbook. And 30,000 copies were made and distributed throughout the country, and that has helped. But you hit the nail on the head. A lot of it is just lack of education, lack of training. The key here in Armenia is reaching those primary care physicians, which, there are about 1,600 primary care physicians throughout the country. We've trained 640 of these primary care physicians, but they need continual training. They need continual education. And one of the reasons, one of the biggest reason ACA recently now comes under the umbrella of the, the Armenian American Medical Society, right? Is because this is big. It's huge. And there's a lot of work to be done in the country around education of healthcare professionals, of the doctors, the nurses, and standardizing the care. So one of the things our national registry, dementia registry, is working on is standardization of neuropsychological evaluation and testing. Neuropsych testing has not been initiated in the country. We are doing that now, and we have collaborated with several neuropsychologists here, and I welcome Lily and Marl also to join us to present and to train the psychologists in Armenia. The psychologists in Armenia, there are psychologists that are interested in this training. And so we're doing that now. That's part of our National Dementia Registry. But standardization of diagnosis is very important. It's very important. And when it's not standardized, it's not baseline testing we're talking about here. That's not a diagnosis. We have to, even the MRI equipment, YSMU has very high level MRI, but beyond that, brain MRI, it's not. So they may be looking at different things.
Right.
This was such a great presentation to hear, Dr. Mahakian. You really have done so much work in the last couple of years to advance something that really needs a lot of additional work, but thank you so much. And yes, absolutely count us in. We would love to help out.
We'd love to do that. We'd love to do that. What time today are you available?
I'll pack my bags right now.
Well, we're going. There are several of us going this fall. We are going to be having our third Alzheimer's disease conference this October. We're going to be having that at NIH, and we are opening up a center in the fall, not in the fall, in the winter of next year in Ichmiadzin. So there's a lot to be done. We can't, the more the merrier, really, honestly. So there's a lot of opportunities here.
Yeah, I think through our organization, Maro, you can add on, as individual neuropsychologists and through MEET, training others, increasing
Exactly.
the visibility of neuropsychologists is really important to us. So if we can get involved, that would be wonderful.
Absolutely. And the team that we have right now for the National Dementia Registry would love to connect with you. Great. And then we can maybe grow that and expand what you're doing, because it's such a tremendous need. Absolutely.
Thank you so much.
Yeah.
I'll obviously echo everything Lily said. I'm very grateful that, we were able to be on this panel together and just learn about the concrete steps that are being taken. A lot of what we talked about is theoretical, and I'm so happy to see sort of in practice what this is looking like, especially in Armenia. Like I said, that picture was just the best thing I've seen today with everybody's arms up. That's fantastic.
Thank you so much.
I don't know if we have like one more minute. I just wanted to ask a quick question about sort of, you addressed some of this as you were talking, but maybe if you can provide like the pros and cons, so to speak, of what has been the most challenging part of sort of implementation and getting some of this going. And on the other hand, what's been some of the most exciting work that, for you personally that you've been able to do?
I think I'll let my husband in the next room answer that. He's had to put up with all of it. Not put up, but he knows the highs. I mean, there've been very few lows. I think a lot of it is just perseverance. And no does not mean no. So if you want to develop something, you do it. You have a passion, you go for it. There's always ways to do it, and money is not an excuse, right? Money should not, the funding will come. You just have to follow what you love to do, and your passion and your vision. I would say all of it has been really challenging. I mean, you can ask my team. Every Sunday we have our team meetings. Our team has grown, and a lot of it is having a team that has passion and love and commitment. That's really what it's all about. And they're excited to expand like the support cafes. They're thrilled to have the support of AWWA. I mean, they're just beyond thrilled. And I am too. And I think a lot of it is just following what you want to do. There's a tremendous amount of work to be done with elder care in Armenia. And I'm not going to start on their nursing homes, because that is a huge project, and develop and really not only standardizing the care, but improving the care of those elders in those 7 nursing homes that are across Armenia. There's a lot of work to be done there. And maybe some of the other established organizations in Armenia can also focus on that also. It's something that we need to do together. I think that as an Armenian, we need to work together. I personally do this, it's all about giving back, and it's all about, it's not about my being able to shine. That's not what it's about. It's about helping people and working together with other organizations. It doesn't matter if we're the first or not, although we certainly have been, but it doesn't matter. What matters is that we're making an impact.
Yeah, absolutely.
Huge.
That's very
inspiring.
I think that way, including other organizations, it just makes it more sustainable and long lasting.
Exactly.
Everyone can contribute. Just like today, we connected, and now there's a collaboration in the making, and that's going to lead to so many amazing things in our community.
Absolutely. Yeah, it'll definitely. And there is absolutely. And that's what it's about. And I think maybe if all of us work together collaboratively and helped each other, I think it would have a much more bigger impact.
Yeah, thank you
Yeah.
so much, Jane. It was very inspiring to hear your work, and you mentioned
Thank you, George.
the persistence and the focus on being on the help, not about other
Yeah,
things, and that was wonderful. Thank you so much. I
excellent.
learned a lot and appreciate it.
Pleasure.
Yeah.
Mhm.
Thank you all very much.
Thank you. Thank you so much for hosting this great panel, both of you. And so great to be on a panel with you, Morale and Lily. Really great.
Thank you, Dr.
Thank you.
Isak.
Yeah. Thank you for making this, our a wonderful conference and panel, and it was such a wonderful way to also conclude our conference for this year. Of course, this organization hosts a conference every year, so we do hope to hear about your updates next year, or just even before that, if you want to say, hey, I want to reach out to the community, I want to share what we're doing. Always, you are all welcome to do that, and we'll be more than happy to support and get the word out, and really show up for our community. Yeah, thank you very much. This has been a wonderful conference. Again, we've had over a dozen presenters in these last 2 days, and I think the videos will be saved on Facebook, so people will be able to view many times and share. And I think it'll be great to just have this also on the record, just to say, look, this is what people are doing, and I'm sure many will be inspired by that as well. So yeah, I don't know if George, you've had any final comments. Thank you so much for also putting all of this together. You've been amazing, and I think it was a very successful conference.
Yeah, no, thank you, Misak. You said everything. I just want to add again, thank all of our presenters today and yesterday and last night, and all our board members who helped to organize this conference. And hopefully we will have this type of conferences many years. And to all presenters and the viewers, please keep in touch. We would love to collaborate with you, with the presenters and the viewers. If you want to join us, join AAMHA. If you are in a psychology field, mental health field, please contact us, follow us. And if you are a viewer, community member, yeah, please follow us in our on our social media pages, and to be informed about the events we have and the work that we do. Thank you, everyone, and I hope you have a great day, evening, wherever you are, and bye.
Thank you so much.
Bye.
Bye-bye.
Mhm.